All right. I've got two in the waiting room and I'll let them in now.
Thanks. Welcome to those who are joining us. My name is Margie Beaudry. On behalf of Trust for America's Health, I'm pleased to welcome you to today's Huddle call to discuss challenges and solutions for ensuring access to the COVID-19 vaccines for older adults and people with disabilities who cannot leave their homes. Please mute your lines unless you are speaking. This session is being recorded so that we can capture all of your ideas and experiences shared. This call series is part of an initiative to identify and foster adoption of innovative and promising practices on this topic. This work is made possible through the generous support of the John A. Hartford Foundation and the Cambia Health Foundation, both of which are dedicated to improving health for all. Terry Fulmer from the John A. Hartford Foundation is with us now, and I turn it over to Terry to say a few words.
Margie, thank you so much. And on behalf of the John A. Hartford Foundation, and I know I speak for Cambia as well, we just want to express our gratitude to Trust for America's Health, Megan Wolf's incredible team, and yours, Margie, for your willingness to move quickly when we sensed this horrible problem for homebound older adults who could not get their vaccinations, people with disabilities who could not get vaccinated, and the way in which we have learned best practices through these dialogues in order to help not only the communities we serve, but our government, who is looking to this knowledge and this document for all of the things we can learn for the future. So our foundation thanks you, and I just hope that everybody knows how much it's meant to us to get your good input and ideas. And let me turn it back to you, Margie.
Thanks so much, Terry. Shauna, the next slide, please. Thanks. When TIFA began this initiative in February, very little was known about the challenges for ensuring that older adults and people with disabilities have full access to COVID-19 vaccines. Since that time, CDC has produced guidance, additional funding has become available through the Administration for Community Living, and there has been much media attention focused on this issue. And working together with many of you, we have developed a set of policy recommendations that will be published this coming Monday and disseminated broadly to help inform and guide policy leaders across the nation. There's also a new guide to innovative practices, which we discussed during our last Huddle call, which is now posted on TIFA's website. Despite the increased attention to this issue, there are still a lot of complexities, including the developing situation with the J&J vaccine, and many states and local jurisdictions have not yet fully identified their homebound populations, nor been able to implement systematic strategies for vaccine distribution to those at home. Our speaker today is Trudy Riebert from the National Domestic Workers Alliance. We're looking forward to hearing her perspective on how COVID has affected that group of professionals and their role in vaccination efforts. After her presentation, we'll open it up for discussion and questions. So Trudy, I'll turn it over to you.
Hey everyone, so nice to be with you today, and I'm excited to have a conversation today. So just a little by the way of introduction, as Margie was saying, my name is Trudy Riebert. I'm Federal Policy Counsel with the National Domestic Workers Alliance. And the National Domestic Workers Alliance, for those of you that don't yet know us, is the leading voice for domestic workers across the country. And when we talk about domestic workers, we're talking about house cleaners, nannies, and home care workers, which is, I think, really sort of how we initially got connected with the Trust for America's Health and sort of started talking about some of these issues in terms of the way that access or vaccination for folks with disabilities and homebound older adults sort of intersects with the workforce, the home care workforce as well. Our members are overwhelmingly women, women of color, and there are a large number of immigrants in the domestic care workforce. The National Domestic Workers Alliance has more than 60 chapters and affiliates around the country, and then we also have individual members. So I wanted to just bring a little bit of the perspective of sort of how domestic workers have been experiencing just a brief bit about the pandemic, and then we'll switch over to vaccines more generally. Sort of like the Trust for America's Health, we've also been working on a set of vaccine recommendations, which we're happy to share around after the call as well. You know, we've engaged with this in a variety of ways. We've done webinars with our members. We've worked on these policy recommendations. We've met with the White House. And then our chapters and affiliates have been really the sort of a key touch point for domestic workers in terms of how to access the vaccines, getting questions answered, and just navigating that whole system. So that's a little bit of sort of where we come into this from. We also partners, or sort of a branch of the National Domestic Workers Alliance, are what we call the NDWA Labs team. Also, very early on in the pandemic, started surveying domestic workers around the country weekly through, it's a really cool technology, but it's actually like sort of through a Facebook Messenger. So they were able to sort of get actually some data sort of ongoing throughout the pandemic, both about the economic impact sort of in the early days of the pandemic, access to jobs, that kind of thing, access to personal protective equipment. And then as vaccines started rolling out, we also added in some sort of specific vaccine questions to sort of get a better sense of sort of how domestic workers were experiencing the vaccination process. So we have sort of a few data points from that have just been helpful in sort of keeping an eye on what's happening. And then also just the conversations that we've been having with members, chapters, and affiliates have also really informed this work. So, you know, I think for us, domestic workers, I think across the board, you know, we're just at the sort of forefront of, or the front lines of the pandemic. You know, I think the way workers may have experienced that might have felt a little different depending on if they were house cleaners, nannies, or home care workers. I think a lot more of our home care workers, you know, were continuing to go to work throughout the pandemic, but may have seen reduced hours. A lot of our nannies and house cleaners just saw their incomes drop off a cliff because that work dried up. They were told not to come in, all sorts of reasons. And so very quickly, people, I think, were becoming, a lot of domestic workers were becoming food insecure and housing insecure. You know, very few folks had access to personal protective equipment. Very few folks have medical insurance. And a lot of our members, in many ways, because of immigration status, were deliberately excluded from the federal relief packages. So there's a really large impact, and that is still ongoing. And so, you know, vaccination became a very key priority for the National Domestic Workers Alliance. We know it's super critical, both for the safety of domestic workers. You know, their work is requiring them to be in very close proximity to others, for the people that they care for. And, you know, also looking forward to the economic recovery, that vaccination is just such a key part of that. So, you know, I think probably as many of us have experienced, I feel like there's these different phases to the challenges we're seeing with vaccination. And so for the first few months when vaccination, when the supply was really thin, prioritization was a big problem for a lot of our members. I would say that in general, the good thing was that the home care workers did tend to be prioritized for vaccination. They were often, a lot of states were sort of recognizing that they sort of fell into that health worker category. And so they were prioritized early on, or earlier on than other groups. But even still, I think there are a number of challenges that folks face despite that. You know, many of our members are also working in the gray market and private pay market. And so even something as simple as like being able to produce the right piece of paper to show that you're actually eligible as a home care worker for the vaccination, you know, particularly if you're not working through an agency, but you're in the private pay market and working for an individual directly, that gets really sticky. So, you know, we have a set of about 10 recommendations that I'm happy to share after this call, but I really wanted to sort of focus on 4 issues that I think we saw coming up throughout the pandemic, and sort of some of how we and our chapters and affiliates have tried to work on that. So the first thing I wanted to highlight was access to information. Our surveying throughout this vaccine period has been sort of consistently showing us that a huge number of domestic workers, are saying that they would probably or definitely get the vaccine if it were available to them, on the day that they were surveyed, right? So those numbers, it was showing that like 9 out of 10 domestic workers, which is great. At the same time, what we were also experiencing in the survey data and in just conversations with people is that workers didn't have access to good information or ways to figure out how to get their questions answered. And so there was sort of like, yes, people want to get vaccinated, but there were also just a lot of questions. So, I think we hear a lot in the discourse, the public discourse, about vaccine hesitancy. Like, I don't think that's the right way to describe this. I think, and I've also heard other people talk about it as sometimes I think it's just questions that need to be answered. Other times I think there's some amount of what I've heard described as appropriate questioning. This is also, working with a large number of low-income female workers, largely women of color, largely immigrants, right? Like they've just been shut out of the healthcare system for so long, and sometimes, explicitly sort of treated badly by that healthcare system when they have had interactions. And so, like, I think there is some amount of questioning that people sometimes are engaged, like have, that's not inappropriate, right? But folks need access to that information. And so, when in the surveys, we were seeing, even like in our results that we released in April, 53% of surveyed domestic workers still didn't know if they were eligible to get the vaccine, and 84% didn't know when they would be eligible, right? And we saw that too when we were talking with domestic workers in webinars, right? Like people had all kinds of questions, everything from, what's the approval process for vaccines and how does that work, to, very specific things like, if I am lactating, like, should I get the vaccine? If I've had COVID already, should I get the vaccine? But again, this is also largely a group of folks that may not have health insurance. So, the normal solutions of like, oh, you should go talk to your primary care doctor, like that doesn't really work for folks. And then there's also the added layers sometimes of language access, of having that information in the correct language, or like in the language that's accessible to folks as well. So I think I would put that in as in one sort of bucket of issues that I think, for us, we've been really seeing community organizations as having a really key role to play in that, right? So our organization, our affiliates, our chapters are sort of one avenue of that. Having those webinars, we heard back from members, was just really, really helpful to put domestic workers in direct contact with doctors who could answer those questions, even if it was in sort of that group setting. A second sort of bucket of issues is around appointments. I think this may be easing a little bit now that vaccines are more widely available, but what we were seeing, even with home care workers that were eligible, was that the online sign-up systems were just so difficult to navigate, and that limited availability of appointments was a huge challenge. These are folks that are working and can't be on their computer all day to like check for those slots as they're opening up. And even things that may seem simple to those of us that are like do have desk jobs and are very computer literate can be much more difficult, right? Like a lot of folks are accessing that system through their phones. And so even the things like where you click to make sure it appears in the right language if you're not a native English speaker, or if you run into a problem, like sometimes I was hearing that folks would I think in certain states there were systems where you could like sign up in some sort of queue, and then they would be like, oh, okay, there's availability now, you can sign up. But then people would log on online and there would be no appointments, and they weren't sure if they had like run into an error or like how to get around it or what the problem was, right? Like just some of those things weren't very legible to people. So what we found was that we had, I think, some real success with some of our chapters and affiliates in partnering with local officials or local health clinics to be able to directly sign up people for vaccination sites, right? So rather than having to go in and like super laboriously sign up each person, find a slot for each person, they would partner with a community health clinic or something that would say, okay, like on this date, you can bring us 200 people. And so our affiliate or chapter would like build the list of folks and then hand it to them. So that there was also, a fair amount of outreach to workers. And it was also a way for them to sort of bypass the whole technological difficulties and just access issues. So we saw that work really well in Philadelphia. We also, I think, had affiliates in Texas and California that had similar kinds of relationships that worked really well. I'm also heartened to see more experimentation happening now. I know, for example, I live in New York City. I know that New York just expanded a lot of the sites for walk-up visits and have also been really sort of trying to prioritize or do more and more pop-up clinics to put sites directly in people's neighborhoods so it's easy for people as well. So the third issue I wanted to touch on was immigration-related concerns. I think there's just a huge amount of fear about interacting with the government for folks that may have not have immigration status or have precarious immigration status. And the thought of giving over voluntarily information to the government, that's your name, your address, potentially some sort of ID or health insurance if you have it, like that's a really scary thing. And even more scary, I think, after the last 4 years and just the assault that people felt like they were under during the Trump administration. And as I touched on earlier too, I think there's also just issues with how people are able to prove that their work may make them eligible, particularly if you're not getting a formal pay stub or, I remember looking at one county's requirements for what you had to show in California to show that you fell under a certain work category. And it was things like, there were like 4 options. It was like a pay stub, a employer ID, something on letterhead. And I was like, domestic workers are gonna, like very few domestic workers are gonna have any of this stuff. So that can be an issue. And we also just, heard from people that like the experience of going into particularly like the bigger vaccination sites where there may be police that are there, not to in a nefarious way, but like they're just directing traffic, or FEMA run sites where there's people with like Homeland Security uniforms on was just incredibly intimidating to people. And I heard from organizers where they were talking about a worker that like called them up sort of in a panic at the vaccination site because it just felt like they were going into to interact with law enforcement that they had long tried to avoid, and so that can be super intimidating. So, I think the government there, I think from federal government, state government, city governments sort of all have a role to play in this, but like government should sort of be repeatedly making some very specific immigration assurances. And I think, reiterating over and over again, one, that vaccination is free and available regardless of immigration status. 2, that the information you're handing over won't be shared with immigration enforcement. 3, that information is being collected only to ensure vaccine equity and for like the actual purpose of administrating the vaccine. 4, that immigration enforcement won't be present anywhere near the vaccination sites. And 5, that vaccination won't affect future immigration status, and that the Trump administration, the Trump administration had attempted to change a rule, something called the public charge rule, but it comes into, it basically increased and made sort of like much lower level of contact or government aid of any sort, a huge barrier to being able to eventually adjust status or access immigration status in some way. And so I think the fear that was created by that rule, even though that rule has been shut down by several courts and now rescinded, like it still, I think, remains a barrier for a lot of people coming forward, just in terms of the fear. And then the last thing I just wanted to say, as far as what we have also been seeing is that, domestic workers in general, and domestic workers in particular too, they also need paid time off, both to receive the vaccine and then to recover from any of the side effects. I think we've also just been hearing from folks about that, fear of you don't know what the side effects are going to be for any particular person until you experience them or not. But that can wipe you out for a couple of days. And so not feeling like you're going to lose your job if you need to take a day or two off work to recover. So that's sort of just some of what I wanted to bring to the conversation, but would love to hear, what other people's thoughts are or how you're seeing this play out where you are.
Terry, thank you so much. We have anticipated some questions that folks may have for you, and Shauna will put them up on the screen. But I'm gonna kick it off. As folks are thinking about their questions, folks feel free to raise your hand or put something in the chat so that we know you want to join the conversation. Shauna, in this forum, we've talked quite a bit. Terry, we've talked quite a bit about family caregivers and their equivalency with other home care providers in terms of access to vaccinations, that they should be protected in order to protect those who they care for. Of course, often family caregivers are working side by side with paid caregivers, such as your members. And so I'm curious if this has been part of the discussion that you're aware of. So that's just my initial question.
I mean, I think as we've been sort of going through this, our members aren't necessarily like always disaggregated by like what kind of domestic work they're doing. So we tend to have sort of more general conversations. I think we have just heard and seen, I think there are some things that are exciting to us. I haven't seen data on how it's worked and things, but I know there is some experimentation going on in different parts of the country where this was, I guess, less for homebound per se, but still some home care potentially of like, if there was someone that could get to a vaccine site, then the caregiver that came along with them could also get vaccinated. I can imagine the same thing being done, in people's homes if vaccines are being administered that way, which just makes a lot of sense. So I think there's some of that experimentation that I've seen that's exciting, but I don't have a lot more data or sort of firsthand information on it at this point.
I'm curious also if you're aware of, members, your members and their role potentially in administering vaccines, for example, those who are nurses or have other certifications to be able to be vaccinators.
That's not something we've discussed directly, mostly because our folks are often more in the personal care aid roles, home care, but not necessarily like trained as nurses and things. So yeah, I think that's, it's something that's, I think, a good idea, but I don't know if it pertains to our members quite as directly.
Got it. Looking in the chat to see if we have any questions.
Margie, I have a question, if I could.
Sure.
This is Megan. So Trudy, I'm just curious too about if there is a percentage or number of your the folks in your network that actually are assisting those who are homebound, whether they are older adults or people with disabilities, and what the experience has been with that population.
Are you asking about like specific numbers or just in general?
Just in general, yeah. I think numbers would be hard to identify.
Yeah, I mean, I think so I would say that among domestic workers across the country, like the folks that are doing home care work is a huge percentage of the domestic care workforce. And so I think it's been a key issue and something that like makes a lot of, I think we're also sort of struggling with how to figure out like how to get those folks vaccines. It's obviously like a lot more, I think, complicated in the home care setting than, other healthcare workers. Like we're seeing the folks at the hospital just can go into work and yay, they get vaccinated. And that's just a lot more challenging when you don't work at like a centralized care facility like that, where it's much more sort of diffuse and privatized in people's homes.
Thank you. I also was really struck by your comment that that it's not exactly vaccine hesitancy that your network is experiencing, that it's more a lack of information or a lack of access to, to what's out there and availability. I found that very interesting.
Yeah, and I would also say, just in my sense from talking to different chapters and affiliates, is it also depends on where in the country you are, sort of the specific experiences of the population in that area. And I get the sense from talking to our chapter and partners in New York too, that, like, for example, in New York, because of the way that March and April in the pandemic particularly rolled out, and just the huge sort of New York was hit so hard at that point, and I think people just felt really abandoned by the public health system. And so the need to rebuild that trust here, I think, has different sorts of implications for vaccine, like trust in the public health system to get the vaccine, than it might in other areas of the country. So
yeah, thank you.
We have a question from Terry Fulmer. Terry, you want to unmute?
Trudy, that was such excellent content, and it's just so jarring to think about the lives of these individuals. How do you think we can make the best progress on paid time off?
I think there's been some interesting experimentation in different ways. Like, obviously, it would be great if we could just get the federal government to fund it and to mandate that. But that in the absence of that as well, like I think, I was happy to see, I think the Biden administration recently sort of encouraging employers to do that for folks. I know in some places there have also been local laws, particularly in places where there already is some access to paid leave, to sort of encourage that, at least to get, I know in New York there is language about getting paid time off, particularly to get the vaccine. But even in New York, it doesn't have the language about the recovery, which I think is really important, so that people feel like they can do that and won't sort of be at risk of losing their job.
Thanks. It's so good to know you're doing your work. Thank you.
Question from Maggie Orenstein. Go ahead, Maggie.
Hi, Trudy. Thanks for all of that. It was really great. I wonder if you've heard anything from members about family members of the people they're caring for, helping them set up appointments to be vaccinated.
Yeah, I've heard anecdotally, and particularly earlier on, when vaccines were so much harder to access, like, I think a lot of people, and I think some of our survey results show this as well, that, like, when we were asking people if they did get the vaccine, how did they get their appointment? And a lot of times it was because someone, like their employer, or someone in sort of, maybe it was a family member of the employer, like, helped them get the vaccine appointment, and helped them navigate that, like a worker navigate that complex system that was just illegible for a lot of people.
What an interesting example, right, of how these folks are partnering with, with the families that they work with, and they do become a part of the family in a lot of respects.
Is that data available? Sorry, Margie. Is that data available, Trudy?
Yeah, let me see so we have we've been releasing some of the initial results, and I think even just in the next few weeks, we're sort of releasing a mini report with some of the results, and then a result later in the year. So let me post the link we have up for the May and April survey results. Let me just post that in the chat, and then I can also, trying to think though, let me look if it has, I'm not sure if those particular numbers are included in this part of it. But you can also feel free to email me, and if those specific numbers aren't in here, I can also connect you with our data folks and see if they have something more specific.
Thank you.
Thanks, and we'll make sure that link goes out with the recording of this event as well. We have just a minute left, and so I think our time always goes quickly. Shauna, if you could take us to the final slide. First of all, Trudy, thank you so much for taking time with us today. Really really fascinating perspective on a topic that we really have not talked through very much, and it gives a lot of new food for thought. For those of you on the call, today is the last Huddle call in this series. Some of you have been hardcore followers, and we have really benefited from your experience and your insights. So I want to thank those of you, even if this is just your first time, or those of you who've been with us from the beginning. It's been a terrific journey, and obviously we created this series in order to share information, but I think we've also learned a tremendous amount from those of you who've come, and so we really thank you. I wanted to let you know, as you can see on the screen, that the policy brief once again is going to be released this coming Monday, May the 3rd, and the Guide to Innovative Practices is already available on TIFA's website. Megan posted the link in the chat earlier during this call. We want to thank you, Kathy Cubitt. Yes, thanks to Johnny Hartford Foundation and to TIFA and Cambia Foundation for all of this work. And as always, we want to thank everyone here for all that you are doing, and best of luck. Stay safe.
Thanks so much.